Hi class, how you doing? This is Andrew Stokes again. This is discussion board 2, week 3. And this week we're talking about experiential therapy. Um, and I'm going with question number 2. If you have experience using experiential therapy, please share your own experiences working with clients applying this therapy and how your clinical experience have compared to what the video and books describe. Address Christian worldview aspects you found helpful in using these models with Christian clients, and end with the lingering question that you have. Yes, I have had experience using experiential therapy. During during my transition out of the Army, I was a counselor associate at this place called Pine Grove in Hattiesburg, Mississippi, and it's an inpatient treatment center. And I also did my intern there as well, and it was a great place to work. And during that time, we did have a lot of patients that we use experiential therapy. MI primarily is one of the best therapies to use with addiction clients, but experiential therapy, it works just as well. And during that time, um, most of the clients that we saw, they did have some type of co-occurring disorder, along with them being there for addiction purposes. So one of the big things was the confidence course that we had, and um, getting the clients out and getting them doing a lot of group activities together, and it was a good thing for them to actually get out and do those things together, and for them to participate in those things. And um, I remember going through my master's degree program, discovering what experiential therapy was, and how it could be used. And um, from what I saw in the textbooks, and from using it, then it did differ a lot. One thing that I noticed about experiential therapy, it was good dealing with trauma. And a lot of patients there, they had some issues. A lot of them had issues with trauma in their past, so that made experiential therapy one of the hot topics. And from a Christian worldview, Pine Grove is a Christian center. So being there, um, it really related to how counselors are healing, and counselors were they were good at just being well rounded with the patients, and actually giving the patients a good representation of Jesus Christ. And not to say that anyone there was doing that, but from a great aspect of how to live, and how to love one another, and how to take care of your brother. My lingering thought, of my question is, um, how can we uh, show our patients um, that we're there for them, and that we care for them, even at times when they don't want to be cared for. Because I see a lot of patients who come in, and some of them really have some issues with trust, and opening up to some of the therapists that I work with. So how can we show them that we're there for them, and that we care for them? Again, class, my name is Andrew Stokes, and I just want to thank you guys for this time, and thank you for this video, and I look forward to interacting with you. Thank you.